It is not preventable condition, so unfortunately you cannot stop it. But there is silver lining. Very few things hurts parents as much as when they find that their child is showing signs of speech delay. During your parenting, you will notice that a typical 2 to 3 years old can say about 50 words and can speak to 2 to 3 words sentences. And by the age of 3, they can speak in 3 to 4 word sentences. A 1-year-old should be able to use gestures to communicate. Babies see everything and everyone with wonder. When they try to express their joy and concern and are unable to speak, since their vocal muscles haven't yet developed to form words, they are left with no choice but to use their arms and their legs. Toddlers usually try to imitate their parents and speak, but a few parents never get to hear it. Signs of speech delay. If a child is 15 months old or older and is still not using his voice or gestures, he might have a speech delay. A kid is able to pronounce by 2 years. By 2 years, a child will be able to pronounce at least a few full words. Even their names or mom or dad will do. Child start speaking sensible. Also at the age of 2, half of what child speaks should be sensible and not be all baby noise. If the word they speak slur and come out as blabber with the raspy tone, the child may have speech delay. They learn to follow directions. 2.5 years old babies will follow directions. They will learn to relate. A 3-year-old should be able to do relative a lot, like recite rhymes, at least part of them, and might also try to tell stories. And 3/4 of it should be comprehensible. They learn to ask questions. They ask lot of questions due to their curiosity and their newly discovered ability to talk. If your toddler hasn't met those milestones, they may have a speech delay. Causes of speech delay: stuttering and speech delay go hand in hand. Stuttering is one of the top signs you will get to observe in children with speech delay. Some doctors believe that these problems originated from brain, and some believe that it is not the brain itself but communication pathway that causes it. Apart from the conditions that involving the brain and the nervous system, there are other causes that interfere child's ability to speak. Impaired hearing. In a speech delay, it is a most logical cause how a child can speak if he or she cannot hear properly. Sometimes speech delay is not inability to speak but not knowing what to speak, since they cannot hear what has been spoken to them. Autism. Children with autism also have speech delay, but as they will grow, they will learn to speak better. Dyslexia. Words are problematic to children with dyslexia, not just when it comes to writing them, but also speaking. They have little phonological awareness, so it is hard for them to break words into little parts and training to utter them. Heritage. This in a speech delay is not uncommon for a child with speech delay. For a child to have either one of his or her parents with a history of speech delay. If you struggle with communication in your early days, the chances are that your child might have to face the difficulties you have faced. But on brighter side, you have first-hand experience of dealing with this problem, so you can guide your child in most optimal way. In parenting, it is almost impossible to know early on if your child is going to have speech delay. There are no medical tests or scans to spot it. We can know it when the child begins to express these symptoms. If you find an anomaly or any signs of speech delay in the initial period of your parenting years, it is time to take action. It is not preventable condition, so unfortunately you cannot stop it when it is happening. But there is silver lining most of the time. Speech delay are not severe. In parenting, you will see most kids catching up, especially when they get early treatment. One of the good parenting tip is to get your child the help they need as soon as you think there is a problem. Also keep in mind, talking a lot with your child do wonders in speaking normally. And remember not to push and act impatient. Wait and make them comfortable to speak at their own pace. As they get confidence that their speech delay is not bothering you, they would become forthcoming and would love to talk more. If you ponder that your little one is falling behind in their physical, emotional, or developmental growth, don't wait to find out. Talk to your doctor right away. If you found this video informative, please hit the like button and subscribe my channel. See you soon.